So 2 fresh cases now being reported, one in Delhi and Telangana. I'm joined in by Dr Ashish Chauhan, consultant physician at this point of time. Dr Ashish Chauhan, of course, 2 new cases now being reported, and as Dr Harshvardhan, Union Health Minister, was also saying, there's no need to panic, but keep yourself prepared, know the symptoms, know the precautionary measures and try and avoid it and keep yourself alert. That's the way forward.
Absolutely, there is no doubt about it. Say what is happening is there is a lot of media coverage, so there is a lot of scare because of that. So if we actually check with the other things, there are a lot of more things which are more scary. We cannot take it, we need not to be too panicky about it, and we cannot take it too lightly. That's what is the message I think Harshvardhan sir has given, and we all should take it that way. Respiratory viruses attack us every now and then. There was SARS, there was MERS, there is swine flu and everything else, and we need to take it that lightly. There are a couple of precautions which we need to work, and most important of that is, yes, covering your face. That is a cough etiquette which is missing in Indians as such. We've been always told, and I keep telling, that the way we cough in the hand is wrong. We should do it the way it's supposed to be, the new way, where we have to cover our face completely like this, so that whatever we are coughing, it is going on the hands. And if you remember this way, you keep your hands clean, use hand sanitizers regularly, wash hands regularly, and then definitely stay away from any kind of public gathering where there is expected some kind of any parties and all. It's better to slightly stay away from all those things. That's what I will suggest.
Right, absolutely, and also we do understand that the Indian state governments are also very well prepared. We saw how Kerala government tackled the entire cases. There were 3 positive cases reported there. They all then later tested negative, and they all have been discharged. So Kerala government has also taken a lot of measures as far as the state was concerned to ensure that the coronavirus is not spreading. So that is the model that needs to be implemented across the country, and we do understand that the state governments and the centre is keeping a close coordination with all the state governments, and they are prepared to deal with the situation.
Yes, very much. I believe government is doing their part, and we as responsible citizens have to do our own part. The government is big, but citizens are bigger, and the message has to go. So awareness is important. I congratulate your media for doing this part, that we need to talk. Say there is one statement, "Har ek padhai ek ko sakshar banaye desh ko." It's a responsibility for every citizen who is watching this program to educate your Kamwali, your work people who are working at home, who are not readily accessible to the different kind of information which you and me can have it through Facebook and WhatsApp. We need to share the information, and we need to tell them what are precautions to take it. And because it's a respiratory virus and has a similar symptoms like a swine flu, I keep telling people that you must take a flu shot so that you are able to control yourself from one disease. And super infection is always scary. Reaching out early to your doctor is the key sentence for all of us to remember. That's what I would want to leave it with everybody out here.
Right, absolutely. One last question, Dr Ashish Chauhan, before I let you go. There are a lot of doubts that come in the mind of citizens. There are travel advisories that have been issued. Is it safe to travel through plane and travel where coronavirus has been reported? And a lot of family members are also staying abroad, or for many Indians. What is the message for them?
I definitely want to say one thing is, we cannot take it lightly. We do not have to panic. Every year there is respiratory infections, and the flu comes and it goes. It definitely has got some fatality of 0.2%, but it's much lesser than the other dreaded diseases, the kind of other things which are there, which we need to keep ourselves kind of controlled and away from it. What about the advisory? Yes, I think when there is an advisory given by government, we need to stick to it. We should decrease the unnecessary travel, or if you're planning for some kind of holidays kind of stuff, and I believe we can postpone it. That will be a great idea. Traveling in the Airbus, because last week I was in Kolkata, and I believe there is less space and there is more circulation of less circulation of air within the Airbus or any other closed space. So yes, you must avoid that as much as possible, is what I would finally leave it with everybody out here.
All right, absolutely. Thank you, Dr Ashish Chauhan, there for joining us and sharing those insightful, very details.